Quick disclaimer that this episode unfortunately had a technical difficulty, so the audio is not ideal. However, I greatly appreciate you listening anyway and valuing the content. Thank you.
Hello and welcome to episode 61 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix online low back program, and today's topic is a client disaster. A client disaster that took place that we're going to share with you today. Yep, it's usually not something we talk about, and I think you might find it interesting and learn something from it. If you did not catch episode 60 was a big podcast about what causes low back pain. That is the magic question. Everybody asks, Grant, why did this happen to me? Why did I have a disc herniation? Why did this? Why did that? Most people, they just insidiously start to develop low back pain, but why does that happen? I give you two different approaches to that question. One is a evidence-based approach, another is a little bit of my opinion sprinkled in there, but that will cover the world's magic question to answer the number one disability that exists, that you are listening to this to try to attack, to try to prevent, to try to resolve. And every bit of information that you consume is a weapon that you can use against it. But as always, if you're not getting far enough along that journey, then you need to consult help. So contact me and my team. Let's get in touch. Hop on a video and we will help you, okay? If you have not joined my free Facebook page yet either, it is called RehabFix Low Back Program. Go join the Facebook group. We are doing tons of interaction there, posting videos that we're not sharing anywhere else. I'm answering your questions directly, and I'm posting additional core movements that are not listed anywhere on my social media. You need to join our Facebook group, RehabFix Low Back Program. We're also sending individuals in that group free training advice as well. So I'm telling you, you need to join the group. So let's get to today's topic. What is this client disaster? Oh my gosh, Grant. Client disaster? What? Here it is. I'm going to tell you. We started working with a client out in Kentucky about, let me look, I actually have his profile up right here, okay? About 6 weeks ago, I believe. Let me see here. I'll be able to tell you right now. This is happening live. Yep. 6 weeks ago, we started working with an individual from Kentucky. This individual has been dealing with low back pain for 3.5 years with sciatica down the left leg, numbness in the toes, mostly achy behind the hip. Okay, he's been struggling to find help. He's tried a couple big name guys on Instagram that were just telling him, "Oh, just do McGill's Big 3 until you're out of pain, and then come see me." Okay, that doesn't work for really anyone. Low back pain is not that simple. Was seeing a chiropractor 2 times a week, went to a spine doctor who told him he had a lousy disc, and he was knowledgeable enough from listening to podcasts like mine to know that that was a bunch of BS. So he stopped all that crap, okay? He started our program 6 weeks ago. Now, how did this issue begin? It kind of started on a work-related venture. So it turned into a workers' comp case. As soon as we get insurance involved with anything, we know it becomes all kinds of corrupt and messed up. A lot of people thoroughly enjoy our program because it does not mess with insurance, although we will take your HSA. HSA does work. But if we tried to work with insurance companies, this program wouldn't exist. I wouldn't be able to help you to the capacity that I can. Our quality would shoot down into the toilet. It would not work because they tell providers what to do. They tell you what you're allowed to get from your benefits. It's just a joke. It's a joke. If you're not getting results using your insurance, stop using your insurance. Go somewhere else who's going to value you more. Anyway, because he's involved with the workers' comp case, he's trying to get out of it. They're not even letting him get out of it for legal purposes. They're forcing him to go to physical therapy through workers' comp. They're forcing him to do it. Okay? So here's the disaster. Ready for this? In 2 weeks in, he massively improved his back pain, sciatic pain, improved range of motion. 2 weeks in, he goes to his physical therapy appointment, which he's forced to go to. And here's what happens. They're assessing him. He's an obvious flexion intolerant disc. Obvious flexion intolerant disc. Bending forward increases sciatica. Bending forward increases his back pain. He is flexion intolerant. We are doing other movements focused on his disc and nerve to calm that down, and we are doing so drastically. 2 weeks in this program, feeling great, has to go to physical therapy. They go, oh, your range of motion is really limited bending forward. So we're just going to have you try to bend over and touch your toes repetitively for this appointment. The very thing that increases his symptoms maximally. Every time he bent down, increasing the nerve, increasing the nerve, increasing the nerve. Every single rep. And they just told him to bend down and touch his toes for multiple times throughout the appointment. Oh, your range of motion is limited here, so do that. That's like saying, punching the wall hurts my hand. Oh, okay, we'll just keep doing it till it doesn't hurt anymore. What? Oh my gosh. This is the same thing when people have sciatica through their leg and they have a tight hamstring, and they just keep stretching that hamstring, trying to get that sciatica to stop. It usually makes it worse. It's like punching a wall and expecting your hand to eventually stop hurting. Okay? It might get numb because of it, but you're not fixing anything, and you're just continuing to trigger it over and over and over. Let's stop punching the wall. Let's change what you're doing. Let's give you a proper approach. Let's change your plan a little bit so you can start getting results, okay? So this is what he was being told to do at physical therapy. And guess what? It flared him up. It flared him up. Felt awful that day, felt awful the next day, set us back multiple days. I was nervous that it was going to set us back more. Flared him up. Disaster. So with this particular situation, this is one of those situations where multiple opinions can be harmful. You know, everyone's like, oh, get a second opinion. Sometimes that can be extremely harmful to your situation. Okay? What is that second opinion worth? Different advice has different values associated. I know the value of my advice. Most of my podcasts are all worth multiple hundred or 1,000 per podcast. If you actually listen to the information and you apply it, I know what good information is worth. I know how much harmful information can cost you as well. It can cost you a lot more than what you would invest into good advice for a short period of time to get over your issue and be done with it. Or bad advice for weeks, months, or years is going to cost you so much more. So this is an example of a disaster from really bad advice, from having multiple opinions on your situation. And he wasn't happy about it. He was aware. And, you know, I'm not blaming him. I'm not at all blaming him for, you know, doing that. He was doing what he was told, and he has to go there. Otherwise, it can like affect his job, right? Like he has to go. But I strongly encouraged him, hey, you're still in charge. Like they can't tell you what to do if it hurts you, you know? We can modify these things. So I just gave him some advice on how to confront that situation. But multiple opinions are not always good, guys. Multiple people seeing you are not always good. I've worked with some people who are seeing 3 different physical therapists throughout the week while they're working with me. That's not good. That's too much. That's overload, okay? You could have all the money in the world. You could be seeing a different therapist every single day, getting a massage every day, going to see a chiropractor every day. That's not going to help your situation if you don't have the right plan. And if you're getting different advice from different people, it's going to become overwhelming. Your mind's just going to be spinning. And most likely something you're going to be told to do is going to be counterproductive for your situation, which is exactly what happened with our client in Kentucky. So this is why it's so important to invest into someone who knows how to help you, whose goals align with yours. He wants to be able to get back into squatting and deadlifting. Everyone he's seen so far has told him to stop doing that. He wants to get pain-free as quickly as possible. So far, no one's advice has been helpful. Advice has been making him worse. For our clients, guys, on average, during our initial assessment, we see 20 to 40% improvement in one call in 5 minutes. That's our average, okay? On average, most of our clients are pain-free by the halfway mark. We expect results very fast. We expect results immediately, and we expect significant results within 2 weeks. If you're going weeks, months somewhere, and you're getting temporary relief, or you're like, yeah, I think I'm like 10% better or 20% better after a few months, you're wasting your time. You're wasting your time. You're wasting your money. You need to focus on highly valuable advice and invest in highly valuable advice and coaching and guidance with a structured plan. This is what you need to get better. And if you're sitting on the sidelines looking at other people on our page getting better with that plan, it's time for you to jump in. Okay? Because if you start getting the wrong advice from other people and knocks you off the path, it's going to extend that path maximally. You don't want to be that individual who has been, watching our page for 2 years now, not jumping in, trying quick fixes, and you're seeing your life go by at a limited capacity. You don't want that to be you. So I'm going to encourage you to seek the right advice, to jump in, to make that commitment, to do something about it, because it is possible to be pain-free. It is. We've had clients with low back pain and sciatica for 10 years. We have seen many of these people become fully pain-free and back to competing, triathlon, sports, lifting in the gym. It's possible. You have to believe it's possible, though. And you have to be willing to invest into something serious and put in the time. You need to invest your time. You need to invest your time into something serious. You need to put in the work because you're going to get out what you put in. So if you feel as though you're spinning your tires, okay, get in touch with my team, submit an application on my website or on my Instagram bio. Contact us, get in touch, get on our free Facebook group. RehabFix Low Back Program is the name of the Facebook group. Join the Facebook group so that we can help you. We can help you start to find those answers and to put those pieces together so that you can stop getting the ineffective advice that you're getting from other individuals, such as our client from Kentucky, so that you can stop those setbacks. And guess what? After that, we coach them through a flare-up protocol that we go through. 4 weeks later, he's doing amazing. He's at 80% improvement total overall right now. He's at 80% of that 100 mark. He's not even halfway through the program, okay? So we got him back on track even after that, and he's focusing on the right advice and the right plan because he's willing to invest in himself. So I'm encouraging you to do the same. I'm calling you out in the most friendly way possible. It's time to do something about it, okay? If you're watching or listening to this, it is time to do something about it because you have one body, you have one life, and you don't want to see your life go by dealing with pain that is holding you back from living to your utmost potential. So get in touch. Do it now. And if you're watching this on YouTube, please like, comment, and subscribe for the YouTube algorithm. If you're listening, please leave a 5-star rating and review to help this podcast reach more people. Join our private Facebook group. As always, move more, move in nature, move in the sun. Thank you so much for listening and have a great day.